African American women are a population that are untapped for medical research in many ways, because people forget that we are interested in participating and being advocates for our health and wellness. And if we advocate for health and wellness, why should we not be a part of research studies? I think that there are times that investigators will forget us as a study population, especially women that are affluent. Affluent African American women are at risk for many of the same risk factors as other African American women. And so we should be included in the mix of women when investigators are asking us about biobank studies, about genetic studies, and even about chart review studies. And there is a growing level of knowledge within African American women around our rights as research participants. And so if we think about that, this is the perfect opportunity and the perfect time to engage us as a community to be a part of health and wellness. I don't think that they know where to reach us or even the how. That goes back to cultural sensitivity and being culturally appropriate and thoughtful and being willing to ask the tough questions of our colleagues of how do we reach a community of African American women. And then also thinking about research partners and developing relationships with organizations and churches and other community groups that are important to African American women as a way of advocating for our research rights. I think the fact that we know our history, I think now we're advocating more for our rights. And then we also have a growing number of African American scientists that are also helping to get rid of the myths that we aren't protected by research. And that's one of my goals in my career, is to let people know that we do have rights as research participants as well. I do think that there's a wealth of knowledge that we can gain by talking to African American women about our health. We can learn more about their wants and their needs so that we can develop research studies that are important to the community. By engaging African American women as research partners, the science becomes better. It's more thoughtful, it's more engaging. It sheds light to a community that sometimes hasn't always had a voice at the table. And that's one reason I became a scientist. You know, I wanted to make sure that I was given the opportunity to have a voice in things that were important to me and that were going to be mainstay in my medical health.